My name is Lloyd Bluen, and this is my video discussion for week 4, case study, Mr. Stein. Mr. Stein is a 34-year-old married investment banker, company owner. He has visited an outpatient clinic saying that he is experiencing what he has called a nervous breakdown. He reported that he's always been a worrier. He's experiencing insomnia, and the lack of sleep is affecting his life in other ways. He said he's keyed up. He's had some inner agitation, some frustration, and he's been very irritable for the last 6 to 8 months. Some other notable behaviors, of course, he's yelling, he's lashing out. Of course, we talked about the lack of sleep, which can contribute to the irritability that he's having. But one of the things that I thought was interesting, that Mr. Stein grew up in a household of overachievers, and he's had this pressure to overachieve, which I think has created this generalized anxiety from the stressors. And DSM-5 talks about stressors, and one of the things I like about what the DSM-5 says about stress, that it's a physiological response to a real or perceived danger. It involves complex interplay of nervous and hormonal reactions. So Mr. Stein has been in this environment, this stressful type environment, this family environment, for a long time. So much so that during college, when he met his now wife, he was always worried about things. So he's always been a worrier. And now that he's on this investment banking company, his worry and stress has extended from, within himself to now he's concerned about his family, because his business almost went bankrupt. So he has this increase of worry, so much so that he's finding himself drinking a beer to calm down occasionally. There's no history. There's no present drug use or substance abuse issues, even any alcohol misuse. There's no noted cigarette smoking or any other marijuana smoking. So his causes are not from any substance abuse issues. It seems to be, I would diagnose Mr. Stein with either definitely adjustment disorder, because of the different things that he's had to adjust to, the different outside stressors. The bankruptcy definitely has caused some adjustment disorder issues. And I think that Mr. Stein is definitely on the scale of major depressive disorder. Let's talk about let's talk about the adjustment disorders. It can be from any stressors, and I think that he may, because of the length, it's been 6 to 8 months. It's been a long time that he's felt this way. And I don't see. I would say, because the stressors are not seeming to let up. So I would say he needs to be definitely treated with some cognitive behavior therapy for just a generalized anxiety and a depression. Also, I believe that he should be treated with cognitive behavior therapy for the insomnia, because him not getting adequate enough sleep is really causing some other issues. And that's my diagnosis and my analyzation of Mr. Stein case study. Thank you.